Right Honorable Speaker, I beg to move. I move that the bill entitled the Uganda National Roads Authority Act Repeal Bill 2024 be read for the first time. I present the bill and the certificate of financial implication.
Thank you, Honourable Minister. The bill is referred to the Committee on Physical Infrastructure for consideration as per Rule 129 of our Rules of Procedure.
The Uganda Roads Authority Act Repeal Bill 2024. Item 315, the Uganda Roads Fund Amendment Bill 2024.
Honourable Minister for Works.
Right Honorable Speaker, I move that the bill entitled the Uganda National Road Fund Amendment Bill 2024 be read for the first time. I beg to lay the bill and the accompanying certificate of financial implication.
Thank you, Honourable Minister. The bill is referred to the Committee on Physical Infrastructure for consideration as per Rule 129 of the Rules of Procedure.
The Uganda Road Fund Amendment Bill 2024.
Thank you. Now, Honourable colleagues, we are going to receive the statement from Minister of Fisheries responding to the issues which were raised that day, and then we'll proceed.
Statement on the status of preparation of regulations to operationalize the Fisheries and Aquaculture Act 2023.
Honourable Minister for Agriculture. Yes, Honourable Pio.
Thank you, Right Honourable Speaker. Right Honourable Speaker, last week you instructed the Minister of Finance to come today and give a statement on the status of the delayed verification of payments for the ex-employees of the East Africa Community, and also asked the Minister of East African Affairs to give a status on the tabling of the East Africa Community Mediation Agreement Bill. Right Honourable Speaker, as a result of that, the senior citizens have actually come to witness the presentation. However, on the order paper, this is not provided for. So, Right Honourable Speaker, I was requesting your indulgence that, if possible, this statement be provided since the Minister of Finance is here. Thank you.
Yeah, Honourable colleagues, I would advise that before you invite people to come and witness what's going on, you first read on the order paper. Okay? So, for now, I have an order paper I'm following, and I want to be able to amend it. Thank you. Honourable Minister for Agriculture. And I remember it wasn't Minister for Finance, it was Minister for East Africa.
Yes,
Affairs.
Mr. Speaker, thank you very much. As far as I am concerned, I was the one who was here last week, and I didn't make that undertaking. So I'm wondering, it's good you have clarified.
Thank you. I want our senior citizens to know these are issues Parliament has given time, and it will continue giving time. Okay? But next time we can coordinate much better, because I have a lot of competing items. Even when the statements come, sometimes I have other salient issues which I must handle. So next time we can coordinate better, Honourable. Yeah, but the senior citizens must know these are issues we are giving a lot of attention, and Honourable Opio has been at the center of it, and the committee also has done a wonderful job in this regard. Thank you.
Thank you, Right Honourable Speaker and colleagues. I am here to give a statement on the status of preparation of regulations to operationalize the Fisheries and Aquaculture Act 2023. I received official communication from Honorable Obua Hamson, the government chief whip, asking me to present the report today after Honorable Robert Migade Robert, Honorable Migade Robert, and Honorable Moses Kabusu had presented the two issues. And the two issues at hand are, one, why we have delayed to bring the regulations to Parliament. Right Honorable Speaker, I want to apologize for the delay to bring these regulations to Parliament.
Procedure. Honourable Minister, take your seat.
Mr. Speaker, a while ago, referring to the order paper, you said we have a lot of business to transact. I don't know how this government works. You are supposed to bring regulations, and you bring a statement to explain why you have not brought regulations and Parliament. You want to take Parliament time for that? Mr. Speaker, the procedure issue I am raising is whether a minister who is aware that she is supposed to bring regulations must come here and waste our time reading a statement on why she has not brought them.
Thank you. Yes, I think the part of regulations is very clear. It's long overdue, Honourable Minister. We need regulations. But the statement, there was a second aspect on the issue of silverfish, which had been banned. And Honourable MPs from the fishing areas wanted their communities to hear from the minister. And we understand why they banned silverfish. So that's why I insisted on a statement other than saying just bring the regulations. So, Honourable Minister, and I request you read the statement verbatim because you submitted it to
Thank you, Right Honourable Speaker. Allow me summarize in 3 forms. 1, because I received the communication.
Honourable Minister, it's a short statement. Read it the way it is. You see, we have it on record. Yeah. So read it the way it is. It's short.
Which part, Right Honourable Speaker?
You had reached on 1, number 1.
Yes,
as
1.
You have it there. Yes.
I said I want to express my apologies for delaying with the regulations, but right now I want the House to know that we have already distributed this draft to different categories, and we have already given different stakeholders these regulations. What we are now doing is to consult with the different stakeholders, including MPs coming from fishing communities. We are also going to consult with the civil society. We are also going to consult with the different fishers, processors. As you are aware, this should be inclusive. It should be applicable, so that when we bring here, should be evidence-based, so that we bring updated version of regulations. 2, we were also asked.
Honourable Minister, I request you read your statement, especially on silverfish.
Number 2, on the assertion by the Commander Fisheries Unit that it is Parliament that has delayed the regulations, I wish to emphasize that it is not Parliament that has delayed the regulations, but it is our ministry, and being under the Ministry of APU being the commander under the Ministry of Defense, might have assumed that Parliament is the one that passes the regulations. We are going to write to the ministry so that we can interact with and harmonize the position. I also want to wish to clarify that my ministry banned the use of hurry up, not the silver fishing. In my statement, I advise silver fishers to use other methods, not hurry up. The fishers know these other methods by different names, such as chota chota, lampara. These methods, Right Honorable Speaker and colleagues, these methods must use nets with mesh sizes that are not more than 10 millimeter for Lake Victoria, and for Lake Alubat and Kyoga, they should not be more than 8 millimeters. The dimensions of the nets for each fishing vessel should be of horizontal length not more than 90 meters and depth of 14 meters for Lake Victoria, 16 meters for Lake Alubat, and 4 meters for Lake Yoga. The use of hurry up.
Honorable colleagues, the minister is reading a statement. We told her to bring a statement, so we cannot start bringing order. Whether the information is wrong according to you or not, that's what she has brought. So
The
you can
use of
give
hurry
us,
up,
Honorable Minister.
Right Honorable Speaker and
Honorable
colleagues.
Minister, please. I think you need to read the rules properly. When the speaker is speaking, you keep quiet.
Thank you.
We can't continue, huh? Because now a member has raised the matter, he must answer. Okay? Huh? So, honorable colleagues, whether you agree with the information or not, you'll be given a chance of rebuttal so that you show, no, Minister, the information you've given is misleading. Okay? But we can't stop a minister from reading a statement because we consider the information inaccurate according to us. So, Honorable Minister, I'll conclude your statement.
Right Honorable Speaker, the use of hurry up has not been allowed and will remain banned. Silver fishing is allowed only during the dark phase of the moon, that is 15 days per month, and only waters more than 2 kilometers from the shoreline. All fishers are advised to seek guidance from their respective districts and the MAIF staff, technical team that we have at the districts and sub-counties. I thank you, Right Honorable Speaker and colleagues. Thank you for listening.
Thank you. Honorable colleagues, in the public gallery, we have our elders who worked for the East African community, former employees of the East African community. They had come to listen to the statement from the minister. I think Government Chief Whip, I will request you to step out and consult with the Minister for East African Affairs to know when the statement can be ready so that they go when we've told them, at least when we are going to handle their issue on the floor. And then you can report back there. So thank you. Now, the issue was raised by Honorable Migade and supplemented by Honorable Kabusu, and then Honorable Susan Buvuma had also raised the same. And she's the shadow minister. Honorable Kabusu, no, the rules require us to start with the ones who raised the issue.
Thank you, Mr. Speaker. Mr. Speaker, the minister's statement, like you said, was a short one. But for lack of the fitting words, was a shallow one. I'm sorry, Mr. Speaker. Shallow in nature that it did not touch the situation as it is in our fishing water bodies. Mr. Speaker, on Lake Victoria, there is a problem between the Nile perch fishers and the silver fish fishers. These ones are all licensed by the Ministry of Agriculture, Animal Industry and Fisheries to engage on waters. And when the Minister of Agriculture, when the Minister of Fisheries suspended or banned fishing, our fishers since January have been waiting for further guidelines and directives from the Minister. That notwithstanding, Mr. Speaker, I do not know whether, like I said last time, whether the Minister of Fisheries is in charge or is in captivity. The directives, Mr. Speaker, the Minister has no enforcement mechanism of all the orders and directives they make. As per the situation is, it is now the UPDF. There is a unit called Fisheries Protection Unit that has deployed, every district has a sector command. They have deployed soldiers headed by a captain and other lower rank soldiers to implement. The commandant of that unit has been going to every fishing district, opening up, and she was saying on a humanitarian ground that I'm giving you 2 weeks, 2 days, and for my case, I'm not a politician, but the politicians have failed to help you. And for that reason, we came here, Mr. Speaker, to ask guidance that we made a bad law. Whether the minister knows all that is going on our bodies, on our water bodies, and why does the minister give different guidelines and the enforcement people also give different guidelines? And finally, what should our people take? Because now, Mr. Speaker, Parliament is watched by our members of public, and the implementer or the enforcer said go and fish. The minister says we have banned. What should our people take?
Thank you. Now, honorable colleagues, there is what I got. Because when I was in Hoima for Princess's Thanksgiving, and then also when I went to Jonam for the burial of Honorable Emmanuel's dear wife, this issue came up, the one of silverfish, strongly. And it seems the public had gotten it that there is a blanket ban, totally no fishing silverfish. Now, I don't know how that was communicated, but the minister here, in her letter, she says they only stopped hurry up. Sorry, in her statement, they only stopped hurry up fishing method. I'm told these are terminologies of the fishing community. Okay, hurry up fishing method. But then also has said silverfish is allowed only during the dark phase of the moon, that is 15 days per month. That's all I knew. Even I think that's how they have been getting it, the silverfish. Then and only in waters more than 2 kilometers from the shoreline. So, honorable colleagues, what I'm going to do this Thursday, okay? Let us have a meeting. The minister, the commander of the Fisheries Protection Unit, and the MPs from the fishing community. Okay? Let us have a meeting in the conference room. I think we can do 11 a.m. We first go, and the representatives of the fishing, I think they have associations, groups, they have a forum, and we first really go deeper, okay, in this issue, and we see whether what the minister is saying here. Because now it's going to be the minister's word against. Number 2, there is a commander who doesn't have access here. Okay? We are going to go here, we disparage her, we do what, and then she cannot enter this parliament to defend herself, and then we come back and we report to this house what we discussed. The Honorable Minister Baram had wanted to say something, then I'll just pick a few people.
All right, Honorable Speaker. First of all, I would like to thank the members of Parliament who are fighting for their people. But then I also need to appreciate my sister, the Minister, Honorable Helen Adoa, for the statement issued. It is now clear, Honorable Chamuswa, you called it a shallow statement. It is unparliamentary. But what I need to assure you is she has solved the problem. We can now fish 2 kilometers off the shoreline. And no, that is what it's now in Parliament. It's on floor of Parliament. It's on record. So we can fish 2 kilometers, and also we can fish 15 days. We can fish 15 days, and the only method banned is hurry up. So the problem is solved.
Thank you.
Thank you very much.
Honourable Minister, Shadow Minister for Fisheries, then I will allow Honourable Kabanda.
Thank you very much,
Yes,
Right Honourable
I will
Speaker.
allow you.
Right Honourable Speaker, as the Shadow Minister for Fisheries, I can clearly state that I'm really disappointed in the Minister's statement. Why? Right Honourable Speaker, the Fisheries and Aquaculture Bill was assented to by the President in 2023 February. And it is now 1.5 years without us getting regulations, Right Honourable Speaker. Right Honourable Speaker, let the Minister be clear as of when shall these regulations be tabled, Right Honourable Speaker. Because now we are tired of saying, Right Honourable Speaker, several times we've raised this issue here, and the Prime Minister has always promised members here that we shall be meeting as members from the fishing communities. We met for one time and nothing has come out. Right Honourable Speaker, the confusion that has been brought into the fishing sector by both the Minister of State for Fisheries and the FPU commander, we shall not tolerate it. The Minister here has clearly stated it about the fishing, one of the fishing methods of silverfish fishing, that is hurry up. And she's even stating the depth of the water and all the gears to be used. I want the Honourable Minister to clarify to me or help me understand under what law are you getting those guidelines, yet it is the members of Parliament to debate on the regulations and we pass them. Where are you getting these regulations that you're even giving them to people here on the floor of Parliament? Then the other thing, Right Honourable Speaker, the new act is very clear. The UPDF Fisheries Protection Unit is not supposed to be on the lake. We don't know, Honourable Minister, help us understand. Have you failed to give a directive? Because they're not supposed to be on the lake, and they are currently implementing illegal actions on the lake. Lastly, Right Honourable Speaker, why we need the regulations very urgent. They will even help us to limit the importation of illegal materials or illegal fishing gears that are making our fishermen to shift from one method to another. These people are losing a lot of money because of no clear law. We need the regulations for the law to be fully implemented, the operation, so that the law can be consulted for effective implementation. My prayers. Right Honourable Speaker.
No, Minister.
No. Okay, Honourable.
Now you've become ordinary like us.
Okay. Right Honourable Speaker, I want the Honourable colleague to give us a real day or to give guidance as of when these regulations, the time frame, these regulations will be tabled. 2, which directive should the fishermen on the islands follow? You gave a directive, you're still insisting. The FPU commander is still on the lakes also implementing the directive. We need an answer now. Lastly, Right Honourable Speaker, if the Minister for Fisheries, Helen Adoa, cannot table the regulations, I offer myself as the Shadow Minister to table the regulations in this Parliament. Thank you, Right Honourable Speaker.
Honourable Kabanda, you had wanted to.
Thank you, Right Honourable Speaker. And mine was just a suggestion because we have already guided on this. You have already said that the Minister for Fisheries and the MPs from the fishing community should have a meeting on Thursday. Maybe there we can have a debate. I am just suggesting that maybe you can also request the Minister for Defence to be part of the meeting, because the Fisheries Protection Unit does not fall under the Ministry of Agriculture, but it falls under the Ministry of Defense. And anything that is to do with the defense, it is the Ministry for Defense to come and answer,
Thank you.
not PRU.
Honorable colleagues, Thursday, 11:30, conference hall. We shall go deep and we shall come back and report here. Honorable Chief Whip, I need an update. But Honorable Minister, the issue of regulation is not for negotiation or begging. It's a requirement of the law. Within 1 month, we need the regulation. Because we cannot wait all this long, I don't know what the problem is. Yes, Honorable Minister.
Most obliged, Right Honorable Speaker. Right Honorable Speaker, as a minister, I can't just bring my own regulations without consulting with the stakeholders. Because when you bring your own regulations, you have not consulted a man down on the ground, it will be difficult.
Yeah.
But since you have said 1 month from now, we want to promise that we shall bring the regulations.
Thank you.
Allow me, Right Honorable Speaker, also answer what they have raised, with your permission.
No, we are going to go into this maybe in summary.
In summary, I want my honorable colleagues here to understand and to encourage the fishers out there. Nobody should stop silver fishers from going to the lake in the name of hurry up. Right Honorable Speaker, hurry up was a method that was brought by our neighbors. Within minutes, if they put the nets around this compound, within minutes, it will go up to Lugogo, and it depletes lake within a short time. But we have other methods that we have been using all these years.
Honorable Minister, let's discuss this on Thursday as I guided, because I know this issue.
Right, Honorable.
When you see me
when we're in Chankwansi,
when you see me insisting, you now know this issue very well. I know this issue very well. I know how explosive it can be. Let's first have a meeting of minds on the same. Honorable Chief Whip.
Right Honorable Speaker, on the assignment you gave to me, I consulted with the Ministry of East African Community Affairs, and they have asked for 2 weeks in order for them to come and update the House on the subject matter raised by Honorable Dr. Opio, and I wish to further undertake to also put it in writing to them. But they have undertaken within 2 weeks, they can update the House.
Thank you. Yes, Honorable Do. After Honorable Cooper, but we are not reopening matters I've decided. I've ruled on.
Yeah. Right Honorable Speaker, this matter of the former employees of the East African Community, one time it came here, there was a brief statement made by the minister, which was disputed. She had indicated that she was in touch with the claimants, our elders who are up. And I remember one of the honorable colleagues from, I think, Honorable Waki Corner, also gave testimony that such a meeting had not taken place. So as these 2 weeks they prepare, would it be okay if the ministry touches base with this, the surviving members who are here, so that they can have a discussion, and by the time they come back here, they have harmonized some of the things, and we avoid going back and forth.
Thank you. That would be very helpful. And I think Honorable Government Chief Whip, that's on the same. Honorable Cooper? Yes, Honorable Cooper?
Chair, I will reserve the others on the regulations of the fishing bill. Right Honorable Speaker, you look at those old people there. One time we had a meeting in your office, and where you are directed that we would have a meeting with the technical team and then the committee. Now that we have these 2 weeks, like Honorable Odor has stated, can you cause that meeting now to happen between the committee, because now we have new leadership, new members of the committee of the East African community, with these elders and with the officials, together with the two of us who have been leading me together with Honorable Achut, such that by the time the minister comes here, maybe we would have even interacted with the minister and the PS. It's a pain for us to be seated here, and the year in, year out, we are seeing these elders trekking the road. Some of them have died, some of them struggled to get here without transport. Now they have been called here, they are going back with an answer. So, Right Honorable Speaker, I want to appeal to you that you cause the Committee of East African Affairs Community, together with these elders and the technical front, to meet such that by the time they bring a report, most of the issues should have been resolved. Right Honorable Speaker.
Thank you. I really appreciate your concern, Honorable Cooper, but you see, this is an issue where I didn't see any contention, much contention, between what the Minister for East African Affairs is saying and what the petitioners are saying. Because the Minister for East African Affairs is saying, look, the ones verified, there is money. Okay? She's saying there is money. And she says, we have even put in papers calls for these people to bring the documentation. Some of the documentations are not complete and all that. So it's not that there is unwillingness, no. But it seems somewhere, somehow, things are not adding up. So when I say, when for example, I rule that they meet the committee, it means the committee also now goes to also meet the other technical people and coming back to report a wrong process. I think the easiest would be the minister to meet the group, okay? And with the two lead colleagues who have been on this, and then we narrow down the issues. By the time of that meeting, Honorable Cooper and Honorable Achut, you can narrow down the issues. We go to the minister knowing which issues are we looking at. Right, Honorable Kadaga, you said you have money, but you don't have people to take the money.
Right Honorable Speaker,
So,
I want to plead.
So I don't want to assign this issue to the committee. It will again be repeating. I don't know which report the committee will present that is different from the one they presented last time. So let's handle it so that the association, the team, can meet with the Minister for East African Affairs. Honorable Achut.
Right Honorable Speaker, I request that in that same meeting, the Ministry of Finance also be present, because one of the key issues is that Ministry of East African Affairs has already submitted files to the Internal Auditor General under Ministry of Finance for verification. It is now almost a year, but the Internal Auditor General has failed to get back to the Ministry of East African Affairs with the computations so that they can compile a budget and present to Cabinet for approval. So I really request that let Minister of Finance and the Internal Auditor General be present in that meeting so that we can be able to get that issue addressed.
Sure.
And also the Attorney General, because there is the East Africa Community Mediation Agreement Bill, which the Minister indicated last time that she was also having challenges navigating through the processes within the Attorney General's office to ensure that it is stable on the floor itself.
Thank you.
Thank you.
Government Chief Whip, I think you can coordinate all this. Finance, Honorable Msasiza has given us all the time we ask him for. I don't think he can deny us this time. But in the meantime, you can talk to the Internal Auditor General at the Ministry to be expediting this process in preparation for this meeting. Thank you. So Government Chief Whip, coordinate this. Okay? Please.
Right Honorable Speaker, the records available indicates that this matter has been around for some time. And from what I've found out on the 27th of April 2022, the Honorable Opio raised the same matter, which was responded to that time by the Ministry of Public Service. I don't know under what circumstances. Should have been East African Community Affairs. I am also informed that the Minister of State for East African Community Affairs was invited or summoned by the committee recently, and they also interacted over the same. I believe progress is being made. You have charged me with the responsibility of coordinating. I will coordinate Honorable Opio to lead this team, first to meet with the Minister of EAC, but later the Minister, as committed, should also update the House on the progress made to pay these senior citizens. Honorable colleagues, tomorrow we shall also be like them. It is important we consider their matter and we have it resolved. Thank you.
Next item.
Item 4 on the other paper, motion for adoption of the report of the Public Accounts Committee, Central Government, on the Auditor General's report on referral hospitals and specialized health institutions for the year ended June 2023. Debate ensues.
Thank you. Honorable colleagues, we are going to do 30 minutes of debate on this, and then we receive other reports, because we have the report was presented last Thursday. So if you didn't read, please don't crack. Yes. Yes. I'm starting with members who were here that day, who waited for the reading of the report. I put down their names. They are the ones I'm giving priority during the debate. Yes. Please. I have colleagues who left here at 8:45. So it would be unfair for me if I don't give them priority. So I'm trying to see some who are here. Honorable Katabaz Francis. If you're a member of the committee, please. If you know you're a member of the committee.
Thank you very much, Right Honorable Speaker. And I would like to thank the chairperson and the members of the committee for such a wonderful report. Of course, it clearly showed the variance in the NTR as what is submitted, and of course we clearly saw some hospitals like where we come from, Masaka, submitting less to the treasury as compared to what they collect. Then the other issue is about the medicine in the stores, which is always delivered very late. Now, I really don't know. I think something must be done about this. It's a common thing that the medicines are normally delivered very late. Now, I wonder when somebody is prescribed the medicine and then it comes after 6 months, what the intention of the suppliers and the Ministry of Health, we really need to caution them. And the stores being so limited and not being up to date is also one other thing which I noticed in the report that should be worked on to make sure that storage facilities are worked on. There is enough space for the medicines. And then, of course, the staffing levels of the hospitals, they are quite wanting. And the general service delivery, or like when somebody is sick, I think that's why some of us here have had issues going there, and maybe they had to be flown from some other smaller health centers to the specialized ones. Yeah, thank you very much.
Thank you. Honorable Dr. Charles Sayume.
Thank you, Right Honorable. I would like to thank the committee for their report. Right Honorable Speaker, on the issue of non-tax revenue, the ceiling set by Ministry of Finance are low, and yet most of these regional hospitals and the national referral hospitals have the potential to collect above and beyond. So it's my humble request that Ministry of Finance increases the targets for NTR, but also allows some of that NTR to be spent at source for maintenance and motivating some of these health workers. Right Honorable Speaker and colleagues, if the rules permitted me, Right Honorable Speaker, I would have knelt down that specialized services in this country can't be free. We are in a neighborhood where some of our neighbors rely predominantly on our services. We shall run down our heart services, our cancer services, if we think that in the spirit of Pan-Africanism, our healthcare system, especially the super specialized services, can be entirely free. Right Honorable, as I conclude, the ICU in Mulago, 28 beds, 14, as he had said in his report, are working. And honorable members and colleagues, our ICU services are 2 million shillings per week in Mulago Hospital. But when you go to the private sector, it's 4 million shillings per day. And sometimes members are in the queue, you're spending in the private services, and yet you're trying to get space in Mulago. So it's my humble request that we find that money, 580 million shillings, to recruit the requisite staff so that the other 14 beds can be operational. Finally, Right Honorable Speaker, I'll insist Masaka Regional Referral Hospital needs 590 million shillings for their ICU to be operational. If we can find that money, we'll have saved lives, because we know that highway is a death trap. Thank you, Right Honorable Speaker.
Thank you, Honorable Jennifer Mbabazi. Followed by Honorable Dr. Singoma Patrick.
Thank you very much, Right Honorable Speaker. I want to appreciate the committee for the good report. My submission is going on two areas. One is on NMS delayed delivery of drugs to hospitals. Right Honorable Speaker and colleagues, whereas we know that delivery of drugs in hospitals is a very big problem in this country, but we should not only look at one NMS as the only problem. We should also look at different factors. In this case, where we noticed that even some hospitals would receive drugs after 6 months. There would be the delay of delivery 6 months and beyond. But as government, we also need to check our house. We need to check ourselves. How is the factor of release of funds to this entity? What is the process of procurement? We should also not ignore the time prior to market authorization. All these are the factors that cause delay. It is a chain. So as we look at, as we crossfire NMS, we should not do it alone, single-handedly, but check out on the issues like delay from national and regional approval and value assessment processes. All those are the factors that lead to delay of drugs to hospitals. Right Honorable Speaker, we also have a problem of quality of drugs. These drugs that are delivered in hospitals, some of them are no longer of quality. For example, malaria drugs. I find that people are not cured by 1 dose of malaria these days. You either have to take 2 or 3. So I wonder, and I want to Ministry of Health to take interest, what does this imply? The other one is on NTR, non-tax revenue. For money to be collected and not remitted to the consolidated fund is a big problem. It is affecting service delivery of these hospitals. We also noticed that Masaka has 3 hospitals which is receiving money, but with 3 accounts that are not, that money is not remitted to the consolidated fund. So as we look at the causes of delays of these drugs to hospitals by NMS, we should look at all these factors that cause the chain of delay system. I beg to submit. Thank you, Chair.
Thank you, Honorable Singoma. Followed by Dr. Yunus Apio.
Thank you very much, Right Honorable Speaker. Right Honorable Speaker, I would like to join my colleagues also in appreciating the good job done by this committee, Honorable Chivumbi and the team, for producing a very, detailed and informative report. Right Honorable Speaker, my attention is drawn to the utilization of warrants. There is a table 3 on page 20. It gives us an insight on how the money released by Ministry of Finance was utilized by the regional referral hospitals. And we see that out of a total of 545 billion, only 95% was used. That was 517 billion, leaving a total of 27.2 something billion unutilized. Right Honorable Speaker, this is a colossal amount of money. And I note that actually the causes of the underutilization is multidimensional. So many dimensions come in, to inform this kind of problem. And one of the major ones, especially which we are suffering from in Hoima, is the lack of enough funds, enough budget provisions, to accomplish established projects. In Hoima Regional Referral Hospital, we have a project which we began, where Ministry of Health put aside, I think, 1.15 billion shillings to construct the maternal and child health care project. This project was supposed to accommodate, the initial plan was for it to accommodate 120 patients total. Later on, the Ministry of Health changed the design, and the project is now supposed to accommodate 250, people. But this also had the implication for the budget provisions, because it meant that the foundation had to be changed. Now, the 1.15 billion is sitting in the Ministry of Defense. For a whole year, it has been sitting there, because the ministry cannot construct, the foundation design was changed, and it now needs 3.5 billion shillings. This money is not there in the budget. It is not even among the unfunded priorities. So we are there. A big referral hospital with a huge catchment area, suffering because of this kind of, imbalance. So I would like to urge the Ministry of Finance and the Ministry of Health to really now, at least for the first time, they should rise to the occasion and ensure that this project, the maternal and child health care project or complex, which was supposed to construct in Hoima Regional Referral Hospital. And this hospital, Honorable Speaker, is just in the center of my constituency. So I would pray that the two ministries, come to our aid and handle this project as quickly as possible. Otherwise, I want to thank the committee for a good job, well done. And Right Honorable Speaker, I beg to move.
Thank you, Dr. Apio.
Thank you very much, Right Honorable Speaker. I would like to thank the committee as well. But also note that there are a number of things that are sticking out. And in this case, for me, I would like to underscore the issue of the high or runaway rate of maternal mortality at Jinja Regional Referral Hospital. It sticks out because it's almost triple the national average. It's at 777 per 100,000 live birth, compared to 189. And I'm wondering what the rest of the country, what the rest of the facilities might be offering, because the committee did not give us that comparative, the opportunity to do a comparative, analysis, on maternal mortality rates. And Right Honorable Speaker, must this continue? I know this underscores the inefficiency. I think that is the mind of that's the mind of the committee, to kind of link the outcomes at the end of the day to the inefficiency that is happening within the facilities, but also they have underscored the rot or the mess in the referral system. And I'm wondering whether we're going to do anything at all about this. 777 is a very bad case. I would like to move, Right Honorable Speaker, that we pick out this particular aspect of our report, of the committee report, and find out more what might be the root, at the root of this very bad figure in Jinja Regional Referral Hospital, and further find out if the situation might be any different in other regional referral hospitals, because well, we don't need mothers dying because they're bringing out new life into the world. Thank you very much, Honorable Speaker.
Thank you. Honorable Dr. Yunus, luckily enough, the chairperson of the Committee on Health is a member of this committee of PAC, Dr. Yonga. So he must have followed up on these issues. And committees, sectoral committees, you need to get interested into reports of accountability committees. Because that's at the time of budgeting, at the time, these are salient issues brought out. It's very, very important for chairpersons of sectoral committees speaking out on these issues, and they follow up on them. Honorable Cooper.
Thank you, Right Honorable Speaker.
Followed by Honorable Ngoya. John Bosco.
Right Honorable Speaker, let me start with the non-tax revenue. Right Honorable Speaker, when you look at the target given to these regional hospitals, it is 34 billion. But the collection which was made is 28 billion. The total budget for this regional referral hospital is 1 trillion. Couldn't the government even make this money available? It's about a trillion. For all the regional referral hospitals. So we are making our people suffer just because of pay. Some even can't afford, get into problems. So can't that be collected? Even those who have met the budget, but the non-tax, their targets, they have done it because they are charging almost everything now when you go to hospital. You find people being charged everything. Two, there is no fee structure in the hospitals. And it has also been brought out in the report. So can the Minister of Health tell us why this is so? Why we don't have a uniform fee structure in all these hospitals? Because you are leaving it to the accounting officers to determine the rate at which they charge the patients. Right Honorable Speaker, when you come to the issue of delayed deliveries of drugs, this is sentencing our people to death. Look at a case of Mubende. 6 months, no drug was delivered. Look at the people who are living on ARVs, who cannot afford. How do they survive? So can the committee tell us what were the reasons given? What were the reasons given for failure to deliver drugs on time? I don't buy the argument given by a colleague, but that's a reasoning that possibly the problem is with the delays in the release of funds. Because funds are released for drugs for all these regional hospitals at the same time, why should others receive drugs and others not receive? Because the money is received at the same time. So that must be addressed, Right Honorable Speaker. There are cases of like Arua, it took 46 days before the drugs were delivered. How do people survive in those areas? Mbale, 69 days. So how will they be surviving? Those who cannot afford drugs. Look at Fort Portal. 3 months, so how? So I think this is what the Minister of Finance, Minister of Health, please help our people. Help our people and find out what is the problem. Because I don't think it's a delay in the release of the funds. Because why should others get on time? There must be a problem with the national medical stores. As I conclude, Right Honorable Speaker, there is the issue of this ban on the recruitment of personnel. Let the ban possibly apply to other areas, but areas that concern about life. Surely, public service should really make exceptions to some cases. Yeah. There should be some exceptional cases for the health sector, because it's about life. If you are not healthy, you cannot be able to do anything, you cannot be able to vote, you cannot be able to mobilize for your party. So why can't they consider them? So, Right Honorable Speaker, I want to appeal to government, and especially public services. The ban on the health recruitment of the staff of the health sector should be really lifted. But also you have seen, Dr. Yume was giving us an example of the equipment that we acquired. The equipment are lying, they're going to run obsolete because we don't have the staff, the technicians. Why would we put a lot of money to acquire all this equipment? but there are no staff to run them. How are we planning? Honorable Musa Sisi, you are Minister of Finance and Planning. Plan such that we are able to have these equipments run. Otherwise, it's going to be a very, very big problem and a vote of no confidence on the leadership of this country. So thank you, Right Honorable Speaker.
Thank you. Honorable Ngoya John Bosco, Honorable Adrico Yovan, Honorable Solomon.
Thank you so much, Right Honorable Speaker. I want to join my colleagues to thank the committee for the good job. Moroto Regional Referral Hospital actually serves a big catchment, including part of South Sudan and parts of Kenya. And the report actually indicates there are lots of drug stockouts and non-delivery of medicine and medical supplies to that particular facility. But also, it actually notes that there is a reduction in releases to the referral hospital, particularly in Moroto. And amidst these huge regional health service needs of the region, you can actually be able to tell why the development indices are very dire in the region. It is one reason why the Ministry of Health needs to be able to take keen interest about what is happening in Moroto Regional Referral Hospital. 2 or 3 months ago, all the Karamoja leaders actually are now putting it together with the Secretary General of the NRM, move around the hospital, and you could actually be able to attest to some of the report that this particular committee has actually indicated. You actually realize there are some key equipment that have not been installed. We had a scanner that had actually stayed outside of the building where it is supposed to be housed for close to about 5 months. Just imagine. And in such a region where there is road traffic accidents, there is no scanner, there is no MRI. People have to actually move to Soroti, they have to move to Mbale. So there is need really to be able to look at this critical resource, this critical facility for the region. It is also, you also realize that at the point when the Moroto Regional Referral Hospital is not providing services, St. Kizito's Hospital, Matanya, has actually been very instrumental. This is a not-for-profit facility funded by the donations from the Comboni missionaries. When they were celebrating their 50 years, there was an appeal that they need to be recapitalized. They asked government to see if they can be able to deal with the 600 million debt that have actually accrued to them. So there is need also for the ministry, together with the office of the president, to be able to recapitalize. Part of the promise they actually made on that day of the Golden Jubilee was that they are going to recapitalize the hospital. Just imagine such a facility providing not-for-profit and actually struggling. We actually need to be able to see how we can actually be able to help them. Thank you so much.
Thank you.
Thank you very much, Right Honorable Speaker. I want to join my colleagues to congratulate this committee and also to thank you for this opportunity. Right Honorable Speaker, Arua District, we have a lot of problems on side of health sector. One, poor service delivery at the health center, and no lack of supervision. And if you go on the ground, you will see people are suffering at the health center. And also, if we take Arua District for our constituency, we don't have a health center 4. We have all health center 2, health center 3. One is called Bondo Health Center 3, Logid Health Center 3, Lazeb Health Center 3, then Ajia Health Center 3. And the distance from Vora up to Arua City, where the referral hospital is very, very far. And we don't have the transport. We have only one ambulance, which is that Arua City. But from Vora up to Arua City, you will see sometimes people are now suffering. And if it is any emergency, then to get the transport become a problem. So our people are suffering because Vora is the border between with the Zombo. From border Zombo to Arua Referral Hospital,
which is very, very far. And also, if you go to the ground there, you see there's a lot of problem still of drugs by the technical staff. You will see government will send the drug. After 2 to 3 days, drug is over. This means some technical people, they're always on the ground, busy stealing the drugs of the government. And we're near the border with the Congo, and the number of people, persons who come and get the service to Uganda are too many. And you'll see people are now lining to go and get the service. I appeal to the government to send more drugs to Vora health centers, and also government should really improve our health center 4 of Bondo to become health center 4 and send more staff so that we can deliver service to our people. So, Right Honourable Speaker, I thank you very much. We have a lot of issues, so I appeal to the ministry to go on the ground and address the issue of Vora on the side of health. Thank you.
Thank you, Honourable Sir Maureen.
Thank you very much, Right Honourable Speaker. I want to thank my honourable colleague who presented a very elaborated report. First of all, Right Honourable Speaker, Arua Referral Hospital does not only serve the people of West Nile. Knowing that we are located at the borderline, we do serve across the borders, the people of Congo, including South Sudan, who also come and get treatments from Arua Referral Hospital. However, Right Honourable Speaker, if it may interest the Ministry of Health, in most of the referral hospitals, take interest in labor suits. The labor suits that were constructed there have become very small in size. Women are giving birth on the floor because of the population. And you know, for Arua City, the referral is located in Arua City, it is worse because we have influx of refugees. So we cannot say that referral is only meant for the people of Uganda, yet the refugees are also part of us. So, Honourable Minister, you need to plan to expand some of those labor suits, not only in Arua referral hospitals, but all referral hospitals. And then secondly, Right Honourable Speaker, in most of the hospital wards, we have insufficient beds. The caretakers of the patients are sleeping on the floor and on the verandas of the hospitals. What are we doing as a country? It is very embarrassing. And now because of that, somebody is taking care of the sick one, you even end up falling sick on top of that. And therefore, I request that the government should fully functionalize the lower level facilities. Some of these referrals could be handled at those lower facilities. Only if you could fully functionalize them with equipment and then medical supplies together with staffing, I think we are good to go. Lastly, the issue of faulty medical equipment. How do you buy equipment of that value? You put it in one place and it's just there redundant. This actually happened in one of the places called Oli Health Center 4 in Arua City. You know, we know very well Arua Referral Hospital is congested. And now Oli Health Center 4 was meant to decongest Arua Referral Hospital. But some of the facilities that are in Oli are not even working, yet we're supposed to operate from there. Are we real serious? And therefore, I want to interest you, the Minister of Health. Health is an asset we should not joke with. Please, may you wake up and pull up your socks and help the Ugandans before anything could happen to our people. Thank you.
Thank you. Honourable Betawo.
Thank you, Right Honourable Speaker. Right Honourable Speaker, it is very sad when we talk about health. It is always important that we improve the facilities which are within the country instead of focusing outside the country. Whether you are as big as what, I think those resources should be used in the country so that more people benefit. Gulu Regional Referral Hospital, where I visit regularly, sometimes my hands are even tied behind my back because of first, the staffing level. Staffing level, you find that it's just about 23%. And this is sad. How can I demand from nurses that you need to do this one better when they are not enough? How do I demand? It becomes very, very difficult. Gulu Regional Referral Hospital would even attract more staffing there if only we could have considered completing the buildings. We should actually host up to over 50 staff. That is an incentive to staff of the Regional Referral Hospital. This building has stayed on, and yet if you look at the building, I am sure if not the park, then the health committee could have seen it, that this building is just left with just very few percentage to complete. The completion is just about to. And yet it has been left there for about 8 years without completing the building. This is very unfortunate. Now, the biggest problem right now with our transport, the Karuma Bridge has been closed. So we have these hospital equipments. We are supposed to use now Gulu Regional Referral Hospital to help our people better. There is this scanner sometime, they say CT scan. CT scan, we have to bring our people up to Kampala sometime because the CT scan is not working. Why should we allow the CT scan or those equipments which are taken to Regional Referral Hospital not to work? We should plan better. We need to plan better to serve our people better. It is not only hospital equipments, but sometimes if you go to facilities in the hospital like the mental health unit, also the mortuary, all these are wanting. We need to do better for our people. We must prioritize social services to the people. Thank you very much.
Thank you. Now, honorable colleagues, I've listened the line of arguments and the line of debate. Please. You all agree with the recommendations of the committee?
Yes.
Instead, now, the line is taking a sectoral committee approach. The issues we are presenting here are issues of the sectoral committee. And Honorable Minister, they are direct issues. I don't know why I should disturb you and come and respond to these issues. Do you have a comment? Just a comment.
Thank you, Right Honorable Speaker. The comment and the issue is to reassure these people that in the ministry we are very serious.
Thank you.
Right Honorable Speaker, just 5 minutes.
Oh, 5 is a lot.
2 minutes.
Minister, because they are direct issues.
Right Honorable Speaker, I take note and observation of what you have said and in the report that most of the issues raised here are general issues and issues of general concern. And for that matter, Right Honorable Speaker, the issues that are of general concern which are being raised are on the NFTR, and we agree with the report as members, and Minister of Finance, my brother and colleague, has taken note of that. Another issue which has come up, and the Right Honorable Speaker, I agree, is about the late supply of drugs, essentials, and the Right Honorable Speaker, you requested that I come here, and I committed. A statement is ready to answer that one. Another one, Right Honorable Speaker, that has come up is the issue of equipments, non-functional equipments, and old ones. Right Honorable Speaker, in this financial year, we have put the budget and the process is ongoing for implementing, installing those that are new, and removing those that are non-functional, and ensuring that everything is done in this financial year. Right Honorable Speaker, Right Honorable Speaker, there are questions again that came up. Can you listen, and I'm coming to you? You see, Right Honorable Speaker, I was on the floor of this house and I committed myself that the issues that were all raised during the sitting of Guru City, responses are ready. I'll address them at the right time. I thank you.
Honourable Minister, those responses, let them be uploaded on our system. Honourable Chair, wanted to make a statement?
Honourable Chair, Honourable Speaker, I have one big policy issue which I want to pose to government, which is across all hospitals, and I would like to differ with the chairperson, former of the health committee. I've looked at numbers. We are paying price. Actually, a part of government is that we are cost sharing in hospitals, and that they are generating significant revenue. But when I look at the scheme of things, how much money, the point I'm making is that Uganda can afford 100% free public access to government hospitals. I will give you numbers. Why we should match these figures and the hospitals are free. NTR collected across all hospitals. If we were to collect 100% in this audit year, was supposed to be a mere 34 billion out of a budget of 555 billion. In percentage terms, that is 6%. When you go to actual collection of NTR, was 28 out of a total warrant of 554. A percentage of 5%. I put it to every head of the hospital I asked, if government matched your NTR collection, will you be able to offer free service to Ugandans? They were saying no. Unless these figures are engineered and that they are hiding some other figures. But if they were to be true, Right Honorable Speaker, we are carrying a huge price politically, is that government facilities are for a pay, or for a money that you can afford to provide.
Thank you, Honorable.
And that's the point I want to pose to government. And if you refuse, in the next manifesto, I will advise my party to offer free services that we shall match this figure.
Thank you. Honourable Minister, do you want to comment on that? Oh,
thank you, Mr. Speaker. Mr. Speaker, on Thursday, when Honorable Chivumbi was presenting this report, he mentioned he used the two terms. One is virement and another one is mischarge. And he kept mixing the two. Virement is provided for under the law. A mischarge is erroneous, is irregular. I thought this clarification, what we are looking for in PAC, our point of concern is a mischarge, because when we look at the virement, as long as it is within 10% and approved by the minister, that one is regular. Point 2, which I would want to invite Honorable Chivumbi to look at in future, are the procurement issues. The procurement issues, sometimes the rules are overridden. We have done procurement audits in many of these entities, and we have found gaps, which I expected PAC to also find, and together, when we are doing a treasury memoranda, we could advise these entities what to do. Mr. Speaker, lastly, pursuant to the requirements of the Public Finance Management Act, I affirm that we shall prepare a treasury memoranda in respect of this report. I thank you very much.
Honorable colleagues, I now put the question that the report of the Public Accounts Committee, Central Government, on the report of the Auditor General on referral hospitals and specialized health institutions for the year ended June 2023 be adopted. Those in favor say aye and recommend nay. The ayes have it. Honorable Minister, we shall be expecting the treasury memoranda like you committed. Next item.
Item 5 on the other paper, motion seeking leave of Parliament to introduce a private member's bill entitled the Food and Nutrition Bill.
Honorable Milton Muuma.
Thank you very much, Right Honourable Speaker. Mr. Speaker, honourable members, I'm moving a motion seeking leave of Parliament to introduce a private member's bill entitled the Food and Nutrition Bill, moved under Article 79 and 94 of the Constitution of the Republic of Uganda, 1995, and the rules 56, 2, and 122 of the Rules of Procedure of the Parliament of Uganda. Whereas Article 79 of the Constitution of the Republic of Uganda empowers Parliament to make laws on any matter of peace, order, development, and good governance, and whereas Article 94 of the Constitution and Rule 121 of the Rules of Procedure of Parliament recognize the right of a Member of Parliament to move a private member's bill. Aware that Objective 14 and 22 of the National Objectives and Direct Principles of State Policy of the Constitution of the Republic of Uganda impose duties on the state to ensure that all Ugandans enjoy rights and opportunities and access to food security, and further enjoins the state to promote food security and nutrition, and requires the state to take appropriate steps to encourage people to grow and store adequate food, establish national food reserves, and encourage and promote proper nutrition through mass education and other appropriate means in order to build a healthy state. Further aware that Uganda is a signatory to the International Covenant on Economic, Social and Cultural Rights, which obligates state parties to recognize the right of everyone to an adequate standard of living for himself or and his family, including adequate food under Article 11 of the Convention. Cognizant that the Uganda Food and Nutrition Policy 203 aims at promoting the nutritional status of the people of Uganda through multi-sectoral and coordinated interventions that focus on food security, improve nutrition, and increase the incomes, and recommends the enactment of legislation on food and nutrition in order to give the policy full effect. Noting that the Uganda Nutrition Action Plan, UNAP2, envisions a well-nourished, health and productive population effectively participating in the socio-economic transformation of Uganda with the goal of improving nutrition status among children under 5 years, school-age children, adolescents, pregnant and lactating women, and other vulnerable groups by 2025. Concerned that Uganda does not have a legislation on food and nutrition, and yet it is imperative for government to set up a legal framework that will enforce guiding principles, guidelines, regulations, and standards on food and nutrition so that the overall strategy of the policy to ensure food security and adequate nutrition for all Ugandans achieved. Now, therefore, be it resolved that Parliament grants me leave to introduce a private member's bill entitled the Food and Nutrition Bill, a draft of which is here attached. And to do order the publication of the said bill in preparation for its first reading. Mr. Speaker, honourable members, I beg to move.
Thank you. The motion seconded. Yes, Algon Cyrus, Abeja Susan, Lokwanga Phillips, Kawaenda Flavia, Kaya Christine, Taka Agnes, Soro, Obiga Rose, Terego, Kasande, Mushemeza, Chirumira, Bwanika, Mukono, Guru, Oyam. All colleagues. Chamuswa. Thank you. Honorable, just 3 minutes speak to the motion. It's very direct.
Thank you very much.
I give 2 minutes to each colleague.
Mr. Speaker, the UBOS report 2022 states or indicates clearly that 54% of all adults in Uganda are stunted or have ever been stunted as a result of malnutrition and poor diets or poor feeding. We have so many cases of this. The PAC report that we have just been considering, some of the deaths are occasioned, I should be particular, like a Jinja regional referral. Most of the maternal deaths result from malnutrition, mothers not feeding well while pregnant. And this impacts on the fetus and finally the child that is born. We have areas in Uganda, Right Honourable, the recent report still did indicate Toro, Karamoja, and Chigezi having the highest number of malnutrition and stunting in Uganda. It's not that these places do not have food, but what is lacking most is sensitization, awareness creation, whereby people do produce food, but they are not educated. They are not told what to eat or how to eat. Even post-harvest handling is not well handled. So we feel there is need for us, one, to look at considering having nutritionists in most of the districts. Members, for your information, out of the 176 local governments, only 25 do have nutritionists or nutrition officers, and these are only placed in regional referral hospitals. But at district level, we do not have nutritionists. So people do produce, like in one of the districts in Toro, Kamwenge, people produce a lot of food. But they eat, someone can decide to eat matoke from Monday to Sunday until the matoke is done. Then somebody again descends on cassava because they lack information. So we are saying, yes, we need to engage nutritionists to help our people know what to eat and in what quantities and at what time. Mr. Speaker, finally, because you've given me 2 minutes, the issue of us having traditional granaries, stores, food reserves is very key. During seasons of plenty, people consume in abundance without forecasting on the future consumption. That's why some of our regions do sell off whatever they have during harvest. Then after 3 or 2 months, they're running to government. We need bailout, we need handouts. This is not sustainable. That's why we are appealing to be granted leave to process this bill that will address some of these gaps. I thank you and I beg to move, Mr. Speaker.
Thank you. Honorable Algon Cyrus, I'm starting with the seconders. If you read on the order paper, they are listed.
Right Honourable Speaker,
We do 2 minutes so that other colleagues can support you.
I'm here to stand strong and stand tall to support the mover of this very important motion of seeking leave of this House. And I feel that it's very, very important that we grant the member as a House that leave that is required. Right Honourable Speaker, he has spoken about nearly everything, but I want to dwell on the legal and planning frameworks. For instance, let's talk about our constitutional rights and mandates, Article 79, Article 94, but also refer to our rules of procedure, 56, 121, 122. Let us talk about the NRM manifesto. When the president and NRM was campaigning for power, they did tell the people of Uganda, we promise you, you'll have enough food. Yes. So, Right Honorable Speaker, we need to fulfill what we tell the people that we are going to provide. We also have to look at SDG 2, which is speaking to the issue of zero hunger. That is very, very important. We have a policy of 2003. How can we have a policy that has been there running for all those years and we do not have a law as a follow-up? It is a major gap. Right Honorable Speaker, if you look at Uganda right now, the level of stunting in the country is terribly terrible. Karamoja is listed as one of the areas. Toro is listed as one of the areas. We cannot accept to continue with this. Teso is also there. Toro. So I'm talking about something with information. Refer to UBO's statistics. Right Honorable Speaker, right now, as Uganda, somebody has already alluded to the fact, the move has talked about us being a signatory to most of the international conventions. We cannot negate on our duty to be people who follow up on domesticating what we have already assigned, put ourselves into responsibility. Right Honorable Speaker, this House will do Uganda a very good service by giving a gift going towards Christmas, and that is providing a bill and a law to cater for food and nutrition. And Right Honorable Speaker, I think the mover was the right person for this bill, and he deserves to be given the permission to go ahead and process this bill. I can tell you our life will change from today if you grant this bill to leave to the member. Things will change. I thank you, Right Honorable Speaker. We are here for you to listen, because I know you support us. You support this bill, and the bill will go through. We can do it within 2 months. Yes, I know you, Right Honorable Speaker. You are there for us. You are there for this bill because you know the importance of this bill. Household heads need to take responsibility in providing for food. We must have the national reserve for food. We must have food for this country. I beg to move. Thank you.
Thank you. Honorable Beja.
Thank you, Right Honorable Speaker. I want to begin by appreciating our move of the motion. Right Honorable Speaker, I'm here to second the motion basing on the following reasons. Right Honorable Speaker, in Uganda, we have agencies that are supporting our country. One of the reasons why we are urging for this bill, these people use their money to do their surveys in our districts. One of the reasons that touched me is when they say that Lango sub-region is not much affected. But Right Honorable Speaker, if you go to Lango, you cannot compare Otuke with a district like Kole and Oyam. At least for them, they have some bit of food for their people. But us, if our country was really having that money to carry enough survey, they would equate us to Karamoja. So Otuke has a district. It's at the level of Karamoja, not at the level of Lango sub-region. Two, Right Honorable Speaker, I'm supporting this motion. The OPM investment plan of 2021, 2024, 2025. They just wanted 3.28 trillion in 5 years to support this program. But since this money was not provided, Right Honorable Speaker, the research that we have got, that if you invest one USD, at the end of the day, in the long run, you can harvest 30 USD out of the 1 USD that you have invested. But Right Honorable Speaker, if you multiply this 30 USD by 3.2, our country is losing 98.4 trillion. That could have been for other issues. Thank you, Right Honorable Speaker. But our motto for this bill is we need money for nutrition and we need nutrition for money. Thank you, Right Honorable Speaker.
Thank you, Rokwanga Phillips.
Right Honorable Speaker, I stand here to support the motion. When you talk about food, it's a basic for all activities and all human beings. It is a basic. And therefore, when you talk about food, the resultant effect of having good food is nutrition. In this sense, therefore, I support the mover of this motion through many other factors. I am sorry people have talked about Karamoja, but the problem is when you talk about the availability, this food we are talking about should talk about its availability. And when you talk about availability, which food is available? Because much of the food that people may think is food available is food that is poisonous for people. So once we put this law, it will help the nutritionists to educate and inform the community on which food is necessary. Another aspect is the costs. I want to inform all of us that when we feed our community very well, we shall reduce the cost in medical treatment. We have just been talking about our hospitals, our whatever, but when a body is well fed with clear nutritional values, then we shall not have costs in our hospitals. Then another aspect is access. Some of us lack information of which food is necessary. How do you get it? Some of the foods we are talking about, when we talk about this, not necessarily we are talking about malnutrition. When we talk about obesity, for example, research says women in Kampala here are more obese than whatever. That is also
just conclude on it. Switch on.
Another aspect is the branding of our foods that we are taking. You will find that some of these packed foods have hidden writings and very small, which does not tell our community which type of food to be bought and be consumed. There are many issues that we need to put, but when we put this law, it will be able to guide the producers and the consumers of this food for better health. Thank you very much.
Thank you. Honorable Kabahenda Flavia.
Thank you very much, Right Honorable Speaker. I would like to thank the Honorable Muuma, who presented the motion to seek for leave to come with the private member's bill on the food and nutrition security in this country. Right Honorable Speaker, the international law requires that every man, every woman, every child, alone or in any community, should have adequate food and or means of procuring the adequate food. Right Honorable Speaker, Uganda is obligated to that. When we look at the Constitution in the Bill of Rights, Right Honorable Speaker, this country does not seem to give us the right to food. Of all the rights we have in that Constitution, we don't see the right to food. And this is not very adequate for a country where we need productivity from the citizenry by having a healthy living. I would like to thank and appreciate His Excellency the President, because he has been a champion of healthy living and healthy eating. He always shares with us how he eats to encourage us to learn how to eat well. Right Honorable Speaker, when you look at the way food is handled in this country today, the state really needs a framework that will remind it to be cognizant of the fact that they have the obligation to protect people, to eat well, and to also prevent discrimination in eating. Look at food fraud, people who label their food and give us the content in the food which actually is not right when you look at the food itself. We are looking at food abuse, when people just lay down mats and put food
when people put food wherever they see and people continue to consume food that is already contaminated by the environment where the food is. Right Honorable Speaker, despite the growing awareness of the importance of food, food literacy has remained the issue that affects people of all ages. When we address food illiteracy, Honorable Speaker, which is now the very, very big challenge, it will be a call to action for us as duty bearers to really support people to learn how to eat, how to handle food, and how to avoid food abuse, and how to avoid bad food vending, and the consumer protection will be ensured, Right Honorable Speaker.
Thank you.
Right
Honorable
Honorable
Kaya
Speaker.
Christine.
Thank you.
Thank you, Right Honorable Speaker, and I thank the mover, and as well second the motion to establish an act. Right Honorable Speaker and members, I am very happy to have this bill tabled because it is the right time now we focused on the safety of food, especially from the gardens. The bill is proposing the establishment of granaries right from districts and at the national level. And we have had a lot of post-harvest handling losses and poor post-harvest handling on our food, to the extent that we are losing a lot of food to such losses. And we have even lost market for some of our food because of poor harvest handling. And I feel when we provide for granaries, then the management of food safety is at hand. Right Honorable Speaker, there are a number of nutrient-dense crops. It is high time we focused on some of these crops to improve and increase their production, not only to look at milk. There are other nutrient-dense crops like orange fresh sweet potato, like rich iron beans, like a grain amaranth, like a silver fish, like soybean, such that we promote their marketability. Even when there is an opening in institutions, we need to balance the sharing of such rich nutrient crops to our population without segregation. Right Honorable Speaker, in our education institutions, we have professional nutritionists. This is a course that has been there for years and years. Every year, we have a number of nutritionists graduating.
Just conclude.
But Right Honorable Speaker, these graduates have no placements. So if we provide for such a law that establishes a slot for a nutritionist at every probably health center, 4 or health center 3, we are assured of employing these youth that are professionals in nutrition. I thank you very much, and I second that the House also supports us in coming up with this bill through the private arrangement. I thank you.
Honorable Taka, Honorable Kauma, Honorable Bigarose, Honorable Narima, Honorable Nayebare, Honorable Kiror, Honorable Ganika.
Thank you so much, Right Honorable Speaker. Right Honorable Speaker, I stand to defend this bill. Honorable Speaker, if you take this motion, Right Honorable Speaker, I'm sorry, the microphone was making noise. Right Honorable Speaker, if you see the availability of colored food, food that is literally contaminated vis-a-vis the locally produced food by our parents and ourselves, and it's made cheap and available to the communities right in the last village of Terego, bottled and with very sweet names that can really prompt you to take, and at the end of the day, you find you're either obese or you have deficiencies. Right Honorable Speaker, if we do not regulate this kind of adverts, unnecessary adverts that derail people from determining to eat the right foods. Right Honorable Speaker, additionally, we have a big challenge. We have so many young girls, teenage pregnancies in our communities who think their children should best be fed in this fizzy or with these fizzy foods. At the end of the day, we get malnourished children, we get children with so many deficiencies, and performances in classes and other types of work go down. Right Honorable Speaker, it is imperative upon us as a parliament to come up and support this bill and make sure we pass it, because this is where we are going to determine the future of Uganda. For example, KFC, to get our potatoes here from Kabale is a problem. It gets its potatoes from South Africa, thinking our potatoes in Uganda have deficiency. And who tested this? A lot of aflatoxin in our food. If we are going to determine, and by passing this bill, determine the quality of food we produce in, far from suffering from losing markets of our food to Kenya and the rest. Thank you so much.
Thank you. Honorable
Thank you so much, Right Honorable Speaker. Right Honorable Speaker, as I second the motion, we really need to have to plan and strategize over matters of food security and nutrition security. Right Honorable Speaker, when we get into detail of this bill, we shall all have reasons to understand more why we have to fight against all that malnutrition, overnutrition, and undernutrition. Right Honorable Speaker, we have a reason as Ugandans and as legislators to fight and reduce the percentage from 29% of children below 5 years who right now are malnourished. And we have a reason to ensure that we reduce and save the 1.8 trillion that is lost by Uganda over malnutrition. We have a reason to see that all of us get back to the health diets. Not what we consume is a health diet. At times we have money, at times we can buy for all our children, at times our children can request for what they may need, but it's not what exactly they're supposed to have. So it's our duty as legislators of this country to ensure that the society first of all, changes its mind upon what is nutritious and also gets to know. And thereafter, we also guide the country to understand better what is needed. We should recall, as research has it, that 54% of all adults in this country at a certain time were malnourished. So we need to get to the statistics, and we are able to save now the upcoming generations and have a better country. I submit and thank you.
Thank you. Honorable Nayabade, Honorable Krol, Honorable Wanka, Honorable Babiko.
Thank you so much, Right Honorable Speaker. Right Honorable Speaker, I would like to thank the move of the motion, and I second the motion. Right Honorable Speaker, as we face rising health challenges like obesity, diabetes, and heart diseases, improving access to nutritious meals is very crucial in our country. Right Honorable Speaker, and if this bill is passed, it will also help us in promoting public health, reducing the long-term health care costs, and ensuring that children and adults have the resources they need to healthier choices. Right Honorable Speaker, by investing in nutrition education, education assistance programs, and support for sustainable agricultural practices is the only way we can foster a healthier and resilient population. Therefore, I support the mover of the bill and the bill at large. Thank you, Right Honorable Speaker.
Thank you. Honorable Krol. Oh, we are flowing where now? No. We are procedurally moving where? Honorable Krol.
I want to thank you, Right Honorable Speaker.
Maybe only that we have had a semblance of peace for some time. It might be a cause for worry, but we are moving where? Honorable Krol.
I want to sincerely thank you, Right Honorable Speaker, for giving me an opportunity to contribute to such a very important suggested bill. Right Honorable Speaker, food provides the basis for our existence. And surely it is very apparent and evident that what is happening now globally is that there's a lot of adulteration when it comes to food. Whereas food is the basis for your existence, also it can be the tool for destroying humanity. Right Honorable Speaker, if you went out now and looked at what is in our markets, there are drinks which have been put in the market. For example, I think there's a drink called Mukama na Yamba, which scientifically has started to demonstrate that whereas the intention is that it enhances, instead it has made a lot of people lose the power. And Right Honorable Speaker, these are not the indigenous things that we have had. The effects are actually very apparent and very evident. So Right Honorable Speaker, I want to thank my colleague Muma for coming up with this. Very important. And honorable colleagues, I want to appeal to all of us to support him so that the House can give him leave to introduce this very fundamental bill. Thank you so much, Right Honorable Speaker.
Honorable Wanika.
Thank you, Right Honorable Speaker. Right Honorable Speaker, I stand to support the colleague. We needed the regulation of food long ago. For us to have quality food, we need regulation. We are losing markets. I've heard the honorable colleagues talk about this very sophisticated market like KFC. You cannot sell a product to KFC unless they are sure of the nutrients within that food. That's why they are importing their products from other countries. We need to help our people regulate so that they can produce quality food so that we can access these markets. So, Right Honorable Speaker, I'm very supportive that the honorable colleague secures leave so that we can regulate the food industry, provide quality apart from the quantity, so that our people don't not only access nutrition, but they also be able to access markets globally that are very important. I thank you, Right Honorable Speaker.
No, I said we are proceeding well. Honorable Babiku.
Thank you so much, Right Honorable Speaker, for the opportunity. I support the motion because one of the problems being faced by this country is food in terms of quantity and quality. Right Honorable Speaker, food insecurity is one of the disasters. And that's why when we are facing these challenges, even per a season, our communities become more vulnerable. I pray that the food insecurity issues get addressed by this bill. And more importantly, I would like to give information that this country does not have a disaster law. And therefore, if we can have this bill, it may temporarily address some of the challenges that this country is facing. The government is not putting much attention in terms of the services in relation to nutrition. And that's why in our districts, much is being done by development partners and non-governmental organizations. It's high time we owned up our major role to ensure that our people are secured in terms of food, but also its quality. Thank you so much, Right Honorable Speaker and colleagues.
Yantonde.
Thank you, Mr. Speaker. I fully support the bill, but I'm seeking clarification from the side of government. They had mentioned of bringing a bill to deal with the quality of food when we're in Entebbe in our private caucus as NRM. I'm seeking this clarification from the Honorable Attorney General, whether this bill will be coming or whether Honorable Muhammad's bill will cover the components of the same bill so that we can be guided. Because some of the members are talking about the quality of the food and all that, like Honorable from Kabone said. So I'm seeking clarification from the two.
Honorable, that's anticipation rule 80. We don't sit in the caucus. We don't know what happens in the caucus. The caucus can't stop us doing business here. Okay? Yeah. Thank you. Yes. Honorable colleagues, I now put the question that the motion seeking leave of the House to introduce a private member's bill entitled the Food and Nutrition Bill be approved. Those in favor say unto the contrary, nay. The ayes have it. Thank you, Honorable. Congratulations. Please. Article 94, 4D. Go to the Attorney General to afford you assistance. Last time I saw some members complaining, you want to suffocate us, you want to do what? No, but it says a member shall get assistance. And colleagues, if you saw, the Attorney General just writes to the President and says, I never rendered assistance. I don't know about this law. And the bill is returned. Once it is returned, you do it. Another time you need 2/3. Colleagues getting 2/3 to come here and support your bill. So it is a matter of strategy and working together. So please go to the Attorney General. He affords you assistance. We should how best we can help each other. Honorable colleagues, we are going to receive one item, and then debate will be tomorrow. And that is, I think that's item 8. Yes. Yeah, next item.
Item 8 on the other paper, motion for adoption of the report of the Public Accounts Committee, Central Government, on the report of the Auditor General on the Justice, Law and Order sector for the year ended 30th June 2023.
Thank you. I hope all these reports are already uploaded. So, Honorable Chair, just go straight to the salient issues. Then members should read.
Thank you, Right Honorable Speaker. Honorable colleagues, I'm here to present a report of the Auditor General on the sector of Justice, Law and Order for the year ended 30th June 2023. Right Honorable Speaker, I beg to lay. Right Honorable Speaker, I beg to lay a report and also the minutes before I go into the details of introducing myself.
We use 20 minutes, Honorable colleague.
Yes, Honorable, Right Honorable Speaker. Right Honorable Speaker, my name is Gorethi Namuga, the Deputy Chair of the Public Accounts Committee, Central Government. And therefore, I'm here to present a report of the Auditor General's report, the Public Accounts Committee report of the Auditor General on the Justice, Law and Order sector for the year ended 30th June 2023. Right Honorable Speaker, Article 163 of the Constitution mandates the Auditor General to submit to Parliament an annual report of the accounts audited by him or her for the year immediately preceding. Right Honorable Speaker, I will directly go to the report, but look into the scope. Right Honorable Speaker, we are looking at 6 sectors: the Judiciary, the Uganda Police Forces, the Uganda Prison Service, Office of the Director of Public Prosecution, the Ministry of Justice and Constitutional Affairs, and the Ministry of Internal Affairs. Right Honorable Speaker, as you are aware, this is a very critical sector to this country, in that we cannot underestimate the importance of law and order to this country. Right Honorable Speaker, I will begin with the Judiciary, Vote 101. And the report has been uploaded, colleagues will read. Otherwise, I want to just note that the sector received a budget of 384,418,804.23 billion. And the budget release was at 83%. They received a wage at 100% and recurrent budget of 100%. Right Honorable Speaker, on the performance of NTR, the entity overperformed. It had planned to collect, the Auditor General reported that the entity had planned to collect 6.3 billion, and during the year it collected 9.9 billion, and that was an overperformance of 157%. However, Right Honorable Speaker, the committee recommends that the accounting officer should set realistic NTR based on the trend analysis, because this over expenditure is an indication that the NTR was underestimated. Right Honorable Speaker, on the performance of warrants, yes, the entity received a budget of 3 warrants of 348 billion, but they only utilized 348 billion, giving a shortfall of 24 billion, 24.97 billion. And these are the areas that were not implemented. The general staff salaries of staff on contract their salaries were not enhanced. So the 24.4 billion was not paid because of failure to enhance salaries. And some of that money was to be used for land titles. The accounting officer could not make full payment since the processing of the land titles was still work in progress. So, Right Honorable Speaker, the staff were denied increment of salary because of delay in processes by the Ministry of Public Service. And the committee therefore recommends that the accounting officer should engage responsible officers in the Ministry of Lands to expedite the processing and acquisition of land titles for the judiciary. In consultation with the Ministry of Finance and the Ministry of Public Service, the recruitment of staff should be rolled over to the next budget. Right Honorable Speaker, on the implementation of outputs, I will be very brief. Most of the budget that was allocated to this ministry, most of the items were under partial implementation. So, Right Honorable Speaker, this indicates that most activities were not fully implemented, and this affects service delivery. For example, the Auditor General noted that as a result of non-implementation of planned activities, training of 20 trainers was not conducted, and 3,500 copies of the Judiciary Retirement Benefit Scheme regulations were not printed, among others, and this affected these activities. And therefore, the committee recommends that the accounting officer should be held liable for the actions, inactions, and commissions that occasioned out of failure to implement the planned activities. Right Honorable Speaker, I will straight away go to the most critical activities for this sector. These are delivery of services from implemented activities. Right Honorable Speaker, you may observe on page 10 that construction of the Chief Magistrate Court at Leptong at a cost of 261 million was delayed. And the reason as to why there was a delay, the accounting officer attributed the delay to completion of works, to non-payment of certified works due to delayed release of funds. Right Honorable Speaker, still for item 2, construction of the Chief Magistrate Court at Patong, which was a contract price of 360 million. The same delay was alluded to failure to release the funds in time, much as the certificates were submitted. And therefore, the committee recommends that the Ministry of Finance should ensure timely release of project funds, and the accounting officer should strengthen contract supervision to ensure that all outstanding works are fast-tracked to completion within 3 months of adoption of this report. Right Honorable Speaker, also operation of courts. The Auditor General undertook an evaluation of the operations of 277 magistrate courts operated by the judiciary and noted the following challenges. Right Honorable Speaker, operationalization of courts. The magisterial areas instrument of 2017 lists the number of courts the judiciary is mandated to establish and operationalize under respective magisterial areas to meet the country's justice needs. As per the instrument, a total of 391 magistrate courts and grade 1 courts were to be established. However, the Auditor General assessed that the implementation of this directive and observed that only 192 courts had been established and operationalized to date, signifying a performance of 49%. And therefore, the committee recommends that government should provide the necessary funding to operationalize all the planned magistrate courts. Right Honorable Speaker, also there is a challenge of inadequate transport facilities for the magistrate courts. And an analysis of the transportation facilities for the magisterial courts by the Auditor General revealed that although 52 vehicles were procured during the financial year 2022-2023 at a cost of 15 billion, there was still a huge transport facility gap. Out of the 82 magisterial areas, the Auditor General found that 6 magisterial areas with over 20 judicial staff had no transport facility. And therefore, the committee recommends that government should provide money for procurement of additional vehicles for all magistrate courts. And also, we should note that there is inadequate access to internet in these courts. Right Honorable Speaker, the Auditor General reviewed the internet coverage across the different courts within the judiciary and noted that out of the 250 courts, only 101 courts, that is a percentage of 40%, had access to internet. And therefore, the committee recommends that government should provide adequate funds to provide internet to enhance automation of, the court system. Lastly, Right Honorable Speaker, the electronic case management information system. Honorable colleagues, you may realize that registration of court cases is done manually. And the reason as to why it's done like this is because there is lack of an electronic case management system. And from the observation of the auditor, the committee observed that the introduction of this system and the full automation of the process was meant to address the case backlog that had continued to bed evil the justice system. The delays therefore mean Ugandans are being denied swift dispensation of justice. Therefore, there is also a possible risk that the total cost of the project, there is also a possible risk of the rise in the total cost project. There was a delay in ensuring that this system is installed. And the accounting officer recommendation, the accounting officer should expedite the installation of the computer infrastructure, and also the accounting officer should follow up on the approval of the system and engage external stakeholders on the use of the same system. IGG should conduct an investigation to establish the causes of delay of this system. Right Honorable Speaker, this system was there was an investment of over US dollars, 420 million US dollars. So the auditor, the IGG should investigate the delay of this project because it is a very huge investment to this country. In UGX, it is a total of 9.277 billion. Right Honorable Speaker, lastly, on this sector is accumulation of domestic arrears. Right Honorable Speaker and colleagues, you should note that the Auditor General noted that management irregularly accrued domestic arrears to the tune of 6.2 billion in the financial year 22-23. And you know how that affects the private sector. And therefore, the committee recommends that government should consider amending the relevant public finance laws and include domestic arrears as a statutory obligation and should take the first call on budgeting. Right Honorable Speaker, domestic arrears is a very serious issue in the area of accountability. We are frustrating the private sector. Sector 2 is the Uganda Police Force. This is vote 144. They received their budget at 98%. And I'm going to straight away go to activities, management of detention facilities in the Uganda Police Force. For the others, you read for yourself. Right Honorable Speaker, during the financial year 22-23, Uganda Police Force, received that budget of 4.021 billion for management of detention facilities. The Auditor General audited the condition of the detention facilities and noted the following. Detention of suspects beyond 48 hours. Right Honorable Speaker, a police officer on arresting a suspect without a warrant shall produce a suspect so arrested before the magistrate's court within 48 hours, unless earlier released. Our honorable colleagues, you should note that it is very illegal and irregular to detain suspects beyond 48 hours. And therefore, the committee recommends that the police should always produce suspects in court within the stipulated 48 hours. The Uganda Police, the UPF officers in cited stations should be held personally liable for violating human rights in accordance with Section 10 of the Human Rights Enforcement Act 2019. Government should provide police with adequate resources and logistics for efficient and timely management of cases. Right Honorable Speaker, on management of transport facilities. Honorable colleagues, lack of transport facilities for policing districts, all divisions, is also a challenge in the Uganda Police Forces. Out of the 60 policing districts that the Auditor General selected for physical inspection, 27 policing districts, 27 policing districts had only one operational vehicle. 29 policing districts had at least 2 operational vehicles, and 4 policing districts had 3 operational cars, and only 1 policing district had 4 operational cars to use for the force to reach out to all corners of the district. Right Honorable Speaker, the accounting officer acknowledged the query and attributed it to budget constraints and the numerous requests for police escort cars. Honorable colleagues, note this. The accounting officer acknowledged the query and attributed it to budget constraints and also numerous requests for police escort cars from ministries, departments, agencies, and parastatals. The accounting officer also stated that some vehicles were given to some politicians, leading to a strain on limited number of police vehicles. Therefore, the committee recommends that all police patrol cars being used illegally by non-entitled officers and individuals should be immediately withdrawn. So whoever has police vehicles not entitled to them, you should return them so that they serve the people of this country. Right Honorable Speaker, on the assessment of management of the closed circuit television, that's the CCTV cameras, honorable colleagues, I request that you read that. And the police also has a challenge of accumulation of domestic areas. Right Honorable Speaker, I will briefly go through that. A trend analysis of the domestic areas, position of the Uganda Police Force over the past 5 years has shown a decreasing trend in domestic areas. However, in the year under review, the financial 22-23, in the year under review, domestic areas have increased from 77.3 billion to 98.81 billion as shown in the table. So, honorable colleagues, the committee recommends that government should provide money for offsetting accumulated areas so as we don't frustrate the people who give services to government. Number 3 is the Uganda Prison Service Forces. That is vote 145. Uganda prisons also received a budget of 340 billion, and that is 98% of release of that budget. I'll straight away go to, you will read that, but I'll straight away go to congestion in prisons. Right Honorable Speakers, strategic objective 1 of the Uganda Prison Strategic Development Plan 2020-2025 aims to provide safe, secure, and humane custodian services for transforming prisoners economically productive citizens. This was to be achieved by building more prisons to decongest the existing ones and reduce the occupancy capacity to the baseline, from the baseline of 293% to 286%. The Auditor General reported that despite strategic interventions of building additional prison wards at Ntungamo, Rukunjiri, Nwoya, Chitaria, Shema, Mutufu, Chenjojo, and Sironko prisons, congestion in prisons remained a big challenge, with prisoners housing only increasing by 1% over the same period of assessment. Right Honorable Speaker, the most affected prisons noted were Isingiro, which had a population of 377 prisoners against a holding capacity of 47. Yumbe Prison, which had 192 prisoners against a holding capacity of 25. Hoima Main Prison had 494 prisoners against a holding capacity of 80. Chivale Prison, with a holding capacity of 30, had 184 prisoners. And Fort Portal Main Prison, which had a holding capacity of 1,770 prisoners, had 309 prisoners. So there is congestion in prisons, honorable colleagues, and therefore the accounting officer attributed the congestion in prisons to high prisoner population with a growth rate of 8% per annum compared to 3% growth in holding capacity. So the growth rate of prisoners is so high at 8%, honorable colleagues. We should note that. And therefore, the committee recommends that government should provide adequate capital development to Uganda Prison Service to enable the implementation of their decongestion strategies.
Conclude, honorable.
And also, among the accounting officer should, together with the wider criminal justice, enhance efficiency for speedy dispensation. The condition in accommodation in prisons, Right Honorable Speaker, is also very alarming, and we should take note of that. And Right Honorable Speaker, briefly, let's look at the office of the DPP, the Directorate of Public Prosecution. It also has challenges of areas and also challenges of understaffing, Right Honorable Speaker. Affairs, Right Honorable Speaker. The ministry has challenges with the challenge of management of funds of the estates of the deceased. There is failure to issue certificates of no objection, but most importantly,
UBC, inspiring Uganda.
We are at Shiloh Standard Nursery and Primary School to reward our lucky winner again for our pay school fees with Momo. We are paying school fees for a student who is lucky because the parent used our codes to pay their school fees. You can as well be our winner for the next school fees prize by dialing *165 *80# and you opt into the competition.
Umiatia goin shag no goy simple wagini kanti bishul kwana tena aneni wa po berane da kwani ba mi gum apu akwa yo dusu meti kere mba mine me ma fen MTM kiken ba mi gum hi man.
Together we're unstoppable.
Max Media Promotion presents Omukwano Chechi Concert, taking place on the 27th of September 2024 at Tavern Woods, Kabusu. There will be exciting performances from Message Semakula, Joffrey.
Community service orders, and also has challenges of
My girl, she a Cinderella dance till she fall off. She not care for money even if you're big and tough. She do it for the love. She a liquor shot till she tipsy. That be dancing, yeah.
Why cross off where I tell no demand? Am I just too selfish? I don't share with no one else. Am I just too selfish?
Don't know anyone who feels so right. Don't know anyone who makes me.
I had to come to terms with it and realize it's the look inside of your eyes. Something about it got.
You sparkle like a star when I dream of you. It's you I long to please.
UBC, inspiring Uganda. This weekend on UBC.
The Uganda People's Defense Forces, UPDF, has undergone a transformation from a small guerrilla force into a large professional national army. National Resistance Army, which later became Uganda People's Defense Forces, has managed to grow from strength to strength because it was founded on the right ideology that emphasized discipline, patriotism, Pan-Africanism, and socio-economic transformation agenda.
Let the demand be, give us more building materials.
Don't miss the UPDF Legacy program on UBC TV that has a central focus on infrastructure development, social, as well as preserving and defending the sovereignty and territorial integrity of Uganda. The program showcases commitment by the Uganda People's Defense Forces in its pursuit of sustainable peace and security in the country, only on UBC TV.
Hujambo mtazamaji wa UBC TV. Kwanza kabisa tunaomba radhi kutokana na usumbufu kwenye mitambo yetu hapa studio ambao umepelekea taarifa hii kuchelewa kwanza, lakini sasa tupo hewani. Naitwa Bella Masangano, na katika habari ya kwanza, Rais wa Jamhuri ya Uganda Yoweri Kaguta Museveni amemtimua kazi mkurugenzi mtendaji wa mamlaka ya uangalizi wa jiji la Kampala KCCA Dorothy Chisaka. Uamuzi wa kumtimua kazi unafuatia ripoti kutoka ofisi ya mkaguzi mkuu wa serikali kuhusu chanzo cha kuporomoka kwa dampo la taka la Chitezi mwezi uliopita wa Agosti. Rais Museveni ameagiza uchunguzi uanze kuhusu janga la dampo la Chitezi ambalo katika kuanguka kwake lilisababisha vifo vya watu 50 na wengine kujeruhiwa huku mali zikiharibiwa. Mbali na Bi Dorothy Chisaka, maafisa wengine wa KCCA ambao wametimuliwa kazi kwa madai ya uzembe uliopelekea dampo hilo kuangukia wakazi wa Chitezi ni mhandisi David Luimbazi, naibu mkurugenzi mtendaji wa KCCA, na Dr. Daniel Okello, mkurugenzi wa afya ya umma katika mamlaka hiyo. Ili kuhakikisha uhamisho wa haraka wa uongozi, Rais Museveni ameiagiza tume ya huduma za umma kutangaza nafasi hizo za kazi zilizobaki wazi kwa lengo la kuwateua maafisa watakaojaza nafasi hizo ndani ya miezi mitatu, huku waziri wa Kampala akitakiwa kumshauri Rais Museveni kuhusiana na uteuzi huo wa muda kuhakikisha kwamba kazi katika KCCA zinaendelea vizuri hadi pale nafasi hizo zitakapotafutiwa viongozi wa kudumu kwenye nafasi hizo. Rais Museveni amedhamiria kuendeleza uwajibikaji na kuendeleza viwango bora vya uongozi kuwafaidisha wananchi wote nchini. Toka wizara, idara na mashirika mbalimbali yametoa ushauri kwa serikali kutafuta suluhu ya kudumu kwa changamoto ya takataka, sio tu kwa ajili ya jiji la Kampala bali pia kwa taifa kwa ujumla. Ushauri huo umetolewa kufuatia kuporomoka kwa dampo la takataka